And President Obama has made health care a priority for his administration. Joining us now is Suncoast Congressman Vern Buchanan to talk about all the issues going on in Washington. Welcome, Mr. Buchanan.
Good to see you, Monica.
Nice to have you here. Okay, so health care, what's the talk in Washington?
I think the big thing is that everybody agrees that the health care system is broken, number one. I think the second thing, and the big thing, is everybody should have health care, accessible, affordable. The big thing that threw the monkey wrench in last week is we found out that for $1 trillion, it would only cover about 15 million people. So that's got everybody kind of concerned because we've got 50 million that are uninsured. And so that's the big issue right now. It's set back a lot of folks. We're going to continue to move forward and see if we can find a way to fix this broken system. And
especially here in our area, in Sarasota, Manatee, Charlotte counties, where we have a large population of senior citizens who rely on Medicare and government-funded health care options.
Yeah, I'm very, very concerned because we have a huge commitment to our senior population. I have the biggest district in the country of 176,000 seniors 65 and older, counting on Medicare, Social Security. Our veterans are counting on their benefits. And we've made that commitment to them. If we don't get the health care thing right, it's going to definitely impact what happens in terms of their benefits, in my mind.
And then speaking about health care and also the administration's bailout of some of the automakers, a lot of people are concerned about where all this money's coming from in budget talks.
Well, it's a legitimate concern. I look at someone you're a lot younger than I am. What are we going to leave the next generation? We're going to incur this year close to, I think, over ideally a $2 trillion deficit on top of a $10 trillion deficit, the debt that we brought into this. And if we're not careful, it gets to a point where nobody's going to buy our bonds anymore. China has a reservation about buying our debt. And, you know, we had Tax Freedom Day. We're going to have a point where we're into May, June, just paying the interest on the debt. So the reason I'm here was one of my biggest reasons was to try to fix that. I think the only way we fix it, we've got to have a balanced budget amendment that says we can't continue, like families and businesses, to spend more than we take in. And this $2 trillion deficit this year, it's got a lot of people concerned.
Do you have some bipartisan support for that?
Yeah, I think everybody realizes that. Unfortunately, when I introduced it, now we've got into this somewhat severe recession. I'm hopeful it's better by the end of the year. But with all these programs and different things that we're looking at doing, I think a lot of people are going to say, how are we going to pay for health care when we got a $2 trillion debt? We need to fix health care, but we've got to be careful that we don't prolong that, because we can't continue as a nation to have deficits in those kind of numbers. It just it's not something we can't do.
Okay. All right, Congressman Buchanan, thank you so much for taking some time out to speak with us this afternoon.
Thank you. Appreciate the opportunity.
Okay, and we'll be right back.